Hello, everyone. My name is Jennie Piccolo, and I'm a precision medicine pharmacist at the William S. Middleton Memorial Veterans Hospital in Madison, Wisconsin. I also serve as one of the pharmacist consultants on the National Precision Oncology Program, which is part of the National Oncology Program for the Veterans Health Administration. I'd like to start off by sharing some of the structure of veteran cancer care. Cancer care within the VA is united under the National Oncology Program, or NOP. NOP diagnoses and treats over 56,000 veterans annually across VA sites. One major goal of NOP is to provide optimal cancer care to veterans that is consistent and standardized across the enterprise. NOP provides many resources to accomplish this on a national level, including established oncology guidelines through the VA clinical pathways based on cancer type and stages. NOP includes a number of services for veterans, such as the National Precision Oncology Program, which will be our main focus today, the National Tele-Oncology Program, which helps to expand access to cancer care via telehealth services in areas where there may be less resources locally, the Clinical Cancer Genetics Service, which provides germline genetic testing and genetic counseling for veterans with hereditary cancer risks, the Clinical Cancer Research Service, which helps to identify clinical trials for veterans who may be eligible, and the National Pharmacogenomics Program, which provides pharmacogenomic testing for veterans, among others. The NOP also houses a number of systems of excellence, including the Lung Precision Oncology Program, the Precision Oncology Program for Cancer of the Prostate, and the Breast and Gynecologic Oncology System of Excellence. The National Precision Oncology Program, or NPOP, was created in 2015 as part of the Moonshot Initiative as a way to develop standardized comprehensive genomic profiling across all VA and remove barriers that might exist for appropriate cancer genomic testing. Some of the resources provided by NPOP are nationally funded contracts that provide access to molecular testing VA-wide, which is at no cost to the individual VA facilities, established oncology guidelines on appropriate testing by cancer type that's incorporated into the VA clinical pathways for cancer treatments, the Molecular Oncology Tumor Board, and dedicated resources located on the National Oncology Program SharePoint, including things like program materials, dashboards on molecular testing, training videos, amongst more. NPOP also provides access to a precision oncology e-consult service to help answer questions on appropriate testing and treatment recommendations. NPOP collaborates with CCGS and CCRS to make recommendations for germline genetic counseling when appropriate, as well as for clinical trial review for veteran eligibility. The NPOP Consult team is an interprofessional team with specialized training and expertise in precision oncology to help with applying precision oncology to patient care. The Consult team consists of a medical oncologist, a molecular pathologist, and oncology clinical pharmacist practitioners, along with national subject matter experts that are available for additional insight when needed. The purpose of the NPOP Consult service is to give physicians across VA facilities a forum to discuss NGS testing results and treatment plans with NOP leadership to ensure all veterans received the highest standard of care. It allows for near real-time dialogue with our precision oncology experts to impact the course of treatment in a meaningful way. When a veteran is receiving oncology care through the VA, they will typically first be seen by an oncologist at their local VA facility or through the National Tele-Oncology Program if local resources are not available. Once the stage and diagnosis are confirmed, an NPOP consult could be placed to request recommendations on what molecular testing is recommended and by which methods to allow for optimal clinical utility of those results. Once those recommendations are provided, comprehensive genomic profiling will be ordered locally, and when the testing results, an additional NPOP consult could be placed for analysis and potential treatment recommendations. All recommendations are documented for the local oncology teams to review and implement as appropriate during the veteran's oncology care. NOP provides a number of resources along the way as well that can be used to optimize veteran cancer care. The VA clinical pathways are treatment pathways based on the cancer diagnosis and stage. These include detailed recommendations for any appropriate testing, including precision oncology and other relevant tests like pharmacogenomics. Molecular testing can be completed through the local VA pathology and lab services or through NPOP, depending on what tests are being completed. NPOP will also provide recommendations for referrals to other NOP services, such as genetics counseling or clinical trial evaluation through various methods. Pharmacist involvement is an essential part of veteran cancer care. Oncology pharmacists at the local VA facility often assist in collaborating with physician colleagues to provide treatment recommendations. They can provide patient education for any upcoming cancer therapies, and they are an integral part in recommending, in consenting for, and ordering pharmacogenomic testing when appropriate. On the NPOP consult service, the NPOP pharmacist consultants will triage all consults, analyze results, and make recommendations that are presented to the full interdisciplinary team for review and consensus. Once a veteran has received cancer treatments, local oncology pharmacists can assist in monitoring for adherence to therapy as well as tolerability, and VA pharmacists are able to work under a scope of practice for cancer-related care, such as the management of supportive care medications to relieve the symptoms of cancer treatments. On the NPOP consult team, we always have 2 pharmacists on consults at one time to help triage interfacility consults and be that primary resource for questions each week. The pharmacist on consults will work up all patient cases, including reviewing the patient's cancer stage, the diagnosis, any prior cancer-directed therapies. We will review the comprehensive genomic profiling results, including whether it was a liquid or a tissue biopsy that was sent for NGS, what the timing of the sample was in relation to previous treatments, as well as what genes and alterations are present. Next, we complete a thorough literature review to assess any potential treatment options based on the results and present all cases and evidence-based recommendations on our weekly interdisciplinary rounds. During these rounds, we will discuss the patient case in depth and thoroughly review alterations found in potential treatment options before providing comprehensive recommendations that are documented in the electronic medical record. The local provider is alerted when the interfacility consults are answered, and they're able to review all documentation and recommendations to then take and implement as appropriate for that veteran's care. Consults are also answered via note documentation in the patient's medical record, as mentioned, and the comprehensive genomic profiling is provided as a PDF that will be scanned into the electronic medical record. NOP has a dashboard library that really allows for the review of patient-level data, including things like whether the patient has received appropriate precision oncology testing, looking at gene and biomarker searches to match up with different treatments or clinical trial options, precision oncology medication searches, as well as the detailed comprehensive genomic profiling results. Additionally, they also have dashboards related to germline genetics testing and whether that has been completed for a veteran, as well as pharmacogenomic testing and drug gene matches that could be implicated. As part of NPOP, there is a monthly oncology tumor board provided for all VA oncology providers to optionally attend. These are presented in a live knowledge-based format with the goal of improving clinical care for veterans with cancer by providing precision oncology education and discuss optimal ways to utilize molecular testing to guide those treatment options. In addition to patient cases, primers on precision oncology topics are often included to further our knowledge and application to patients. The cases presented are selected from the NPOP consults that are seen each week and chosen based on interesting clinical questions or other valuable learning points that we would like to share with the VA oncology community. Each case is presented with the information on the patient's diagnosis and treatments thus far, the comprehensive genomic profiling results, an analysis of the genes and alterations seen, and a review of the primary literature available for treatment options. Following the case presentation, the floor is open to the precision oncology subject matter experts across VA to provide their insight and discuss those complex clinical questions. The Molecular Oncology Tumor Board is moderated by one of the NPOP pharmacist consultants to lead these discussions on treatment and precision oncology application to patient care. I hope I was able to show you today how pharmacists are an important part of the precision oncology care within the VA through the National Precision Oncology Program and the Molecular Oncology Tumor Board education provided to the VA oncology community. Thank you.